Chronic runny nose is a very, very common problem, in terms of patients going to their primary care doctor, but then also making their way into the ENT office for people who do just have this kind of faucet, drippy nose. Oftentimes the workup with that would start with kind of seeing if the patient has allergies. We do allergy testing, but a large percentage of patients actually do not have allergies. It's more of just this clear non-allergic rhinitis or chronic rhinitis. Now this generally falls into a condition called vasomotor rhinitis, just means that the lining of the nose is just irritable. It's not because of allergies, so they don't have the sneezy, they don't have the red kind of itchy eyes. It's more just this clear drainage. And so I will oftentimes start the patient on a medication, see if that works. And that does allow us to really assess that, yes, this truly is something called vasomotor rhinitis. And once the patient does have that diagnosis, prior to the last 4 or 5 years, there really wasn't much we could offer other than nasal sprays. But now there's been an advance called Clarifix, and Clarifix is an in-office procedure where we're actually able to freeze a small nerve in the back of the nose, which actually provides the signal to the nose to create mucus. It's kind of overactive, and it's just giving this kind of signal to the nose to just make mucus all day. And if we freeze this nerve, the nerve shuts off. It actually turns back on over a few weeks' time, but it's generally not as active as it was before. And so there can be most of the studies actually suggest that the benefits are long-term, at least 2 to 3 years, and which can be a tremendous benefit to the patient. So they don't have to use the nasal spray, they don't have to carry this handkerchief, and for the procedure, which takes about 20 minutes, it's done under local anesthesia in the office. I think worth it for a lot of patients. The studies do show that the effect is long-lasting. It's only really been around for about 3 to 4 years, so we don't have long-term data of whether or not this would come back after 5 or 10 years. But we do know that it does last at least out to generally 2 or 3 years. The nerve does come back, but it's downregulated or it's just not as active. So that's really the goal of the procedure. There's been other technologies that have used freezing overactive nerves in other areas of the body that know that the effects can be long-lasting. Clarifix is covered by insurance, and if we do see the patient in the clinic and assess that they're a candidate, we can get all of the prior authorization performed for them.